Hi, I'm Dr. Nick Shamie, Professor-in-Chief of Orthopedic Spine Surgery at UCLA School of Medicine. The purpose of this video is to help you better understand the causes of neck and arm pain, as well as surgical options for treatment. Common sources of neck pain are the muscles in the neck and the exiting nerves of the spinal column. This video will focus on pain from issues in the spinal column or cervical spine. Let's start with the anatomy of the cervical spinal column. Here we can see the bones or vertebra of the cervical spine from the side or the lateral view. And here we see it from the back or the posterior view. Between the vertebra are the discs. These intervertebral discs connect and cushion the spine. The spine is also home to the spinal cord or nerve roots. These nerve roots connect to the spinal cord and relay nerve signals between the body and the brain. Nerve roots exit the spine in between each of these bones or vertebra through an opening called the foramen. Here is the foramen with the nerve showing and with the nerve root hidden so you can see the space of the foramen. When a nerve root is pinched, compressed, or irritated, a patient may experience symptoms of paresthesia, tingling, numbness, or pins and needles in the arms down to the hands. It can also cause pain in the neck, shoulder, or even arm pain, or headaches. These symptoms are known as cervical radiculopathy or ridicular pain. Nerves can be pinched in several ways. If a disc bulges or ruptures, the disc material can press against the nerves and cause pain. When the disc weakens, it is known as a bulging disc, and when it ruptures, it is called a herniated disc. As patients get older, many suffer from degenerative disc disease. This can result in the loss of height and the formation of bone spurs or osteophytes. Nerve roots can be pinched by these bone spurs. Remember the foramen from earlier? Degenerative disc disease is associated with a narrowing of the foramen or reduction in the foraminal area. This narrowing is called foraminal stenosis and can compress the nerve root and cause pain. Fortunately, there are options for treatment, all of which can be effective at decompressing or unpinching the nerve and alleviating symptoms. Anterior cervical discectomy and fusion, or ACDF, is a common procedure which has a descriptive name. Anterior from the front, cervical in the neck or the cervical spine, discectomy, removal of the disc, and fusion. The goal is to have the bones of the vertebra fuse or join together. ACDF typically involves removing the disc and replacing it with a spacer or a cage made of titanium or PEEK, which is a special plastic. A plate may also be used to secure the bones with screws to provide additional stability. ACDF can be performed on a single level or on multiple levels. Total disc replacement looks to remove the disc and replace it with an artificial disc. It is typically used with younger patients to preserve motion. Here you can see the artificial disc during a surgery and after the surgery. Another option is a posterior cervical fusion. A traditional posterior fusion uses screws and rods to create space between the vertebra and decompress the nerve root. It can be performed on a single level or on multiple levels as shown here. Patients with special risk factors may be candidates for a combination of procedures. Here we see a circumferential fusion or 360 fusion with an ACDF in the front or anterior and fusion with screws and rods in the back or posterior. The last option I will cover is also the most recent innovation and advancement. This approach uses a small titanium implant about the size of a Tic Tac or a Pez candy. These implants work by lifting apart the vertebra to restore space in the foramen and decompress the nerve root. This before and after image shows how fusion with DTRAX cervical cage can increase the area of the foramen. This in turn decompresses the nerves. I like this option because of its versatility. DTRAX cervical cage can be used by itself or in conjunction with other procedures to treat foraminal stenosis, as shown here and here. DTRAX cervical cage also stabilizes the spine and is comparable to a plated ACDF in reducing range of motion. Preventing motion helps increase the likelihood of a successful fusion. It's just like when someone gets a cast after breaking an arm. You want something to hold the bones in place so they can heal and fuse together. Rather than redoing the previous surgery or another major surgery, DTRAX cervical cage can provide another opportunity to decompress the nerve roots and create a fusion. Here we see an example of a patient with a non-union where the vertebra failed to fuse. Rather than replace the anterior hardware, the patient underwent a posterior fusion with DTRAX cervical cage, which results in a successful fusion. The implant is indicated for a 1 level, however in some cases I elect to use it in multiple levels. DTRAX cervical cage can be used as a part of a 360 fusion for patients with a high risk of complication. Here we see a plated ACDF combined with a posterior cervical fusion with DTRAX cervical cage, and from another angle. When you combine the DTRAX cervical cage with an ACDF, the range of motion goes almost to zero. And again, this is a good thing because we want to stabilize the spine to allow for a fusion to occur. A fusion with DTRAX cervical cage is comparable to ACDF and total disc replacement at improving symptoms. Patients report improvement in just weeks, and for the vast majority of the patients, the improvement is significant. But what patients usually like the most about DTRAX cervical cage is how it can be performed using a tissue-sparing technique. The largest instrument is just 1 centimeter in diameter. That's smaller than a dime. This approach can reduce time spent in surgery in the hospital and position patients for a faster recovery. It also can result in a favorable cosmetic outcome. Scarring is minimized and on the back of the neck, where it's much less visible. Here we see 2 patients just 14 days after posterior fusion with DTRAX cervical cage. I hope this helps you better understand the various options for advanced treatment of cervical foraminal stenosis and pinched nerves. I thank you for your attention.